knee pain after falling while cleaning the garage. His medical history is positive for a mechanical mitral valve replacement with subsequent anticoagulation using warfarin. On assessment, the client's knee is swollen and tender to palpation. He appears pale, and there are multiple bruises on his arms and legs. Based on these findings, the healthcare provider suspects overcoagulation and orders a prothrombin time and international normalized ratio. Now, normally, bleeding is stopped by the process of hemostasis. First, platelets stick together to form a plug. Then, the coagulation cascade is activated, which involves several clotting factors that interact within the intrinsic, extrinsic, and common pathways, ultimately creating a mesh that stabilizes the clot to help stop bleeding. Alright, prothrombin time, also known as protime or just PT, measures the time in seconds it takes to form a clot. It is used to evaluate the extrinsic pathway. Similarly, the international normalized ratio, or INR for short, is the time it takes to form a clot presented as a ratio of the client's PT to a control or standardized PT. The normal values for PT range from 10 to 14 seconds, while INR ranges from 1.0 to 1.3. Now, there is a therapeutic value for INR, which is higher, for people that require some level of anticoagulation, like in the case of a mechanical heart valve. In this case, the INR range is 2.0 to 3.0. Typically, PT and INR are drawn together and referred to as PT-INR. Alright, the PT and INR can be increased if there aren't enough clotting factors, which can happen due to reduced production or if the clotting factors get used up. Now, since clotting factors are created by the liver, severe liver disease like cirrhosis can reduce clotting factor synthesis. Now, the liver needs a supply of vitamin K to make clotting factors 2, 7, 9, and 10. So, another way PT and INR can increase is when clients are given a vitamin K antagonist, like warfarin, to therapeutically prevent clots from forming, like in clients with mechanical heart valves or atrial fibrillation. Finally, clotting factors can be depleted in disseminated intravascular coagulation, or DIC, which causes widespread thrombosis that uses up clotting factors. Alright, a PT-INR is typically measured if there are signs or symptoms of impaired coagulation, like easy bruising, hematoma formation, which is a collection of blood in the tissues, hemarthrosis, or bleeding in the joints, excessive epistaxis, also known as nosebleeds, or gastrointestinal bleeding, which could present as either blood in the stool or emesis. PT-INR is also measured to monitor liver disease, to establish the client's baseline PT-INR before starting anticoagulation therapy, and to monitor the effectiveness of warfarin therapy. Okay, let's look at the nursing management for your client with an elevated PT-INR. Goals of nursing care are to assist in identifying and addressing the underlying cause, and monitoring for complications. Begin by collecting a sample by venipuncture. Typically, you'll use a light blue top tube. After obtaining your sample, gently invert the tube 5 times to mix the additive sodium citrate without causing hemolysis or breaking a part of the red blood cells, which will alter the results. Keep in mind that clients taking an anticoagulant or with altered blood clotting often have increased bleeding after a venipuncture, so be sure to apply pressure to the site. Now, if your client has an elevated PT-INR, monitor for signs and symptoms of bleeding and implement bleeding precautions such as avoiding unnecessary invasive procedures, multiple blood draws, or intramuscular injections. Also, implement fall precautions to help prevent injury. Monitor your client's serial lab results, and if their PT exceeds 46 seconds or INR is 5 or above, notify the healthcare provider immediately, as these are critical levels. Alright, as a quick recap, prothrombin time, or PT, is the amount of time it takes for blood to clot. PT is commonly reported alongside the international normalized ratio, or INR. PT-INR results can increase when there aren't enough clotting factors, which can happen due to reduced production, inactivation, or if the clotting factors get used up. PT-INR is typically measured if there are signs or symptoms of impaired coagulation, to monitor liver disease, to establish the client's baseline PT-INR before starting anticoagulation therapy, and to monitor the effectiveness of warfarin therapy. Nursing implications include assisting in identifying and addressing the underlying cause and monitoring for complications.